Hi everyone, I'm Emily Darlington. I'm an associate professor at the University of Lyon here in France, and I'm the task leader for the feedback and revision of the European standards and indicators for health promoting schools. So let me introduce our working team. We have 3 members of the research group: Bruto Santos from the University of Porto in Portugal, Julien Masson from the University of Lyon in France, and also myself. I'm a core member for the SHE research group. And we have a national coordinator, Electra Bada, who is a national coordinator for Greece, and she was the task leader for last year's task. And of course we have the support of Annette Schultz, who is the manager of SHE. Now, to just give you a little bit of background, last year the European Standards and Indicators for Health Promoting Schools were developed with 2 aims: to provide guidance on how to evaluate and monitor health promoting schools across Europe, taking into account a wide range of contexts and with the purpose to upscale existing practices, and also to provide a valid, usable and measurable set of indicators to accompany each standard as an evaluation tool for health promoting schools. The final result was a set of 8 standards, which were included in the project management cycle, as you can see here on the left. And each standard comes with a set of indicators and also guidance as to how to measure state of the play, achievements, and monitor the development of the HPS framework in schools. We also included a user's guideline to make the document as easy to use as possible. The European Standards and Indicators for Health Promoting Schools framework and users' guidelines were designed as an adaptable monitoring tool with a view of developing, upscaling and sustaining existing and emerging HPS strategies and practices. Now this is on paper, and now the question is it usable in real life context? So before we take the standards and indicators to real life use, SHE decided to carry out an intermediate task which would fill the gap between the drafting of the standards and indicators in 2019 and their use in the future. So from the feedback from pilot countries, the European standards and indicators will be revised and implemented in 2021. We have 3 specific aims for this task: to identify potential prerequisites to the use of the SHE standards and indicators, to assess their clarity, readability, usability, usefulness, relevance, adaptability and fit to different national contexts, and also to draw key lessons and acquire essential knowledge to revise the standards and indicators developed in 2019. In other words, how can we improve the European standards and indicators so that they are usable, adaptable and in tune with the variety of the different country contexts? And I, for one, think our task is to provide a common framework like a skeleton, but which gives room for adaptation. We have 3 targets for revision: the model, the formulation of the standards and indicators, and also the user's guidelines. So here you can see examples of the questions we're asking ourselves. Does the model make sense? Is the model usable? Is it relevant? Do we need to make changes to it? What is the target group for this document? Who is this document relevant for? Or we can ask ourselves, do the standards and indicators make sense? Are they usable, relevant? Do we need to make changes? And the same again for the user's guidelines. National coordinators will play a key role in this task because they will contribute to framing the relevant questions which need to be addressed by the task, and they will also identify the best way to retrieve information and report to the task group. So basically, the role of the task group is to facilitate the collection of relevant and important data in order to revise the European standards and indicators in a pragmatic, translational, practice-informed way, which aims to support future implementation. As this task is carried out, in-depth feedback from stakeholders on issues the task group and also national coordinators identify as being essential will be added to the data collection. So now you can see on this map countries involved, and we're working with them on a regular basis, and we're really looking forward to taking this task forward and moving on to revising the standards and indicators based on the precious feedback we will get from national coordinators and stakeholders in the different countries. So this is all from me. Watch this space for more news about SHE activities. See you soon.